young people, heart disease, and there's all this question, is it because of COVID vaccine? Is it because there's some conspiracy going on? And when I walk, I'm short of breath, I'm fatigued, I have exertional chest discomfort. Not everyone has classic crushing chest pain like you see in a movie and falling down. We all have stressful lives, right? We have to learn techniques as to how to handle stress. It's easy for me to come and say, okay, stress paathukonga. You have to work on it, just like anything else in life. I asked them, when is the last time you had a checkup? I'm fine. I don't need a checkup. See, here's the thing. Nama blood pressure and nama cholesterol and many times even diabetes is asymptomatic. So unless you have testing done, you won't know. A new symptom, discomfort, nagging shoulder pain, heartburn, whatever, because it can present in various ways. If you don't know what it is, it's a new symptom that's lasting for a couple of minutes, get to the nearest ER or the hospital. Therapy for a patient should be based on what the patient needs and not my ability to open up a blockage or not. So get an opinion, if need be, from a second competent cardiologist.
That introduces a remarkable figure in the field of cardiology, DR.Arun Kalyanasundharam. He is an US-trained interventional cardiologist who has pioneered high-risk and complex coronary procedures in India, especially in the area of chronic total occlusion angioplasty. He is known for bringing cutting-edge cardiovascular care to patients who previously had no treatment options. His dedication to innovation and excellence has earned him recognition both nationally and internationally. Please join me in welcoming DR.Arun Kalyanasundharam onto the stage.
Good morning, everyone. I'm incredibly honored and humbled at the excellent video, first of all, and thank you, Mr. Shivashankaran sir and IO for this opportunity for me to be here. I'm here to talk about a couple of things. The first thing is I have a conflict of interest. As was mentioned, right? I treat complex blockages in Chennai and pretty much in a lot of places around the world. But today's talk is not about treatment. We'll touch upon that a little bit. It's really about how do you prevent this. I had some excellent speakers before me that have already given you an overview. And in fact, Dr. Gomati just gave a talk, and I think every word that has been spoken thus far, I can tell you, if you follow all this, you will greatly reduce the chance of getting into problems in the first place. So I'm going to switch gears a little bit and talk about a few basic things. Heart disease, what do we mean by this, right? For a heart attack, because a lot of people there are certain myths, which is like, okay, cardiac arrest aiduchu, heart attack small heart attack, periya heart attack, so let's just get down to the basics. When you look at heart disease, it's any disease that involves the heart pretty much comes under heart disease. So the most common kind of heart disease that we see, and the number one killer of people, men, women in India and abroad, essentially is coronary artery disease. Adennan paakla. Of course, you can have rhythm problems. There are certain congenital cardiac disorders. Heart failure is when the heart doesn't pump very well. And cardiac arrest basically is when your heart has just stopped working for whatever reason. Now, the elephant in the room, it's coronary artery disease. So here, there is plaque buildup, blockages that form in the blood vessel supply to the heart. Every organ in the body needs blood, and that's how it gets oxygen, including the heart itself. And the thing about the heart is that as soon as the blood leaves the heart, it kind of takes care of itself first. Now, when you have blockages there, that is a problem. Idhudan coronary artery disease. So when you have blockages that prevent blood from going downstream in the vessels, it can cause symptoms. Many times you'll hear people saying, when I walk, I'm short of breath, I'm fatigued, I have exertional chest discomfort. Not everyone has classic crushing chest pain like you see in a movie and falling down. For a lot of people, this is a very slow, insidious onset. So they'll just be like, okay, I was able to climb up 2 flights of stairs before, but now I can't because I'm just getting tired, etc., etc. So these could be early on symptoms of coronary artery disease. Now, of course, sometimes what happens is that a plaque, the blockage, it's like a volcano. It ruptures, as you can see here, and this is a fairly complex procedure, but the third picture, you kind of see that it kind of looks like a volcano. So very simplistically, if you can think about this, in the plaque basically has cholesterol, macrophages, smooth muscle cells, and a lot of other things. Especially lipid core irukkumbodhu, if there is rupture, which is the most common cause that leads to a heart attack, it can result in a blood clot forming on top of this rupture. and it prevents flow. So this is basically a heart attack. Now, when there is no blood supply to the heart, so it's a plumbing problem. This can lead to electrical problems, like rhythm problems. Cinema like, people go into ventricular tachycardia, ventricular fibrillation, and shock. So, a ventricular tachycardia or when ventricular fibrillation, your heart is pumping very ineffectively. And this essentially is incompatible with life. So within 5-6 minutes, if you're not pumping blood, the brain, you're basically dead at that point. And we see this, right? India, like young people, heart disease, and there's all this question: is it because of COVID vaccine? Is it because there's some conspiracy going on, and there's something in the water? What is going on? And it's very scary, especially like in my news every third day we keep seeing this. Now, there are multiple reasons. We'll kind of do a little bit of a deep dive on why we have a lot of heart disease in our country especially, and also about how we can prevent it, and if you can't prevent it, what you can do about it. So we do have a disproportionate amount of coronary artery disease in India. Okay, so if you look at overall South Asia, we are a hugely populous subcontinent, and we have the distinct privilege of having the world's disproportionately large percentage of heart disease. Now, this is a combination of several things, lifestyle, some of it is our genetics and certain unique metabolic factors. And the thing is, first of all, we don't get regular checkups that much. Number two, most of our lifestyle stuff is, I would say, suboptimal. And on top of it, even the standard guidelines that are based on Western populations don't really, they kind of underestimate the risk of Indians. We are anywhere from 2 to 4 times more likely to develop CAD. Typically, almost a decade before onset of heart disease, symptomatic heart disease, Indian population compared to the Western population. And when you have disease, it typically tends to be more severe. In fact, Dr. Kothindaraman talked about diabetes and some fantastic points that he made. So unfortunately, diabetes is coronary artery disease or twin mari vechukongala. They kind of go hand in hand, and we also have a lot of diabetes. So many times the vessels that we have in our diffuse disease coronary artery disease the multi-vessel disease, left main involvement, and because of a lot of comorbid conditions and overall our frailty index, we tend to have even poorer outcomes following CABG, etc. So this one-size-fits-all doesn't work. Now, again, metabolically active normal weight. This is something that I want to kind of emphasize on. Many of us are like, it's business as usual. Things are going on. I know my body. There are so many myths about overall health, I would say. And of course, people that are quote-unquote within the normal, let's say have a normal body mass index, feel like, I'm good. I don't have to worry about it. The problem is that a lot of us have visceral fat, and this typically is kind of a very, very nice place where inflammation happens, and that is not good for us. Okay, this inflammation, as in fact Mr. Shivashankaran sir had just talked about, that's the buzzword, leads to a lot of bad things, including heart disease. Now, almost 50%, say 43% of people that have a normal BMI in our part of the world are actually metabolically unhealthy. And the problem is we are blissfully unaware of this problem. So multiple ways, and again, I'm not getting into the details, but this is more of an overview. Exactly, I don't think time will permit us to go into it, and we are happy to answer offline. But one of the key things is check out your waist circumference. It's not that hard. And again, there's been an extensive diabetic talk, so I won't get too much into it, but the long and short of it is that we as a population have more insulin resistance as well as not as good beta cell insulin production. So it's kind of a double whammy. So more diabetes, more heart disease. Again, looking at cholesterol and other stuff, right? We have more LP small a. It's something that we don't test routinely. And we also tend to have more high triglycerides, really low, the good cholesterol, which is HDL. And LDL kuda pathina, it's more of the dense LDL particle. And even the statins and a lot of the stuff that is normally prescribed for high cholesterol typically doesn't work that well on LP small a. One more thing, right? We tend to have more low-grade inflammation. Again, visceral fat being a big culprit. Insulin resistance, it all promotes atherosclerosis. We also tend to have higher levels of PAI1 and fibrinogen, which are all like clot-promoting things. And so finally, the other thing is there are also certain genetic like SNPs, etc., single nucleotide polymorphisms that are more prevalent in the South Asian population that does put you at a higher risk. So General or cardiologist பார்க்குறீங்க general doctor பார்க்குறீங்கன்னா they'll always ask you, do you have a family history of heart disease? உங்க அப்பா அம்மா யாருக்காவது have they had heart attacks before the age of 40 or 50, depending on the gender, bypass or whatever, because it tends to run in families. Okay, so just to summarize, skinny fat, insulin resistance, atherogenic dyslipidemia, and high LP small a. So idellame bad news, right? I mean, it's all doom and gloom. It's just saying that life is all bad for South Asians. That's not the thing, right? So what can we do about it really is what this is about. So number one, and again, very, very basic stuff. We tend to be very, very high on refined carbs in our diet. Usually, right? I would say try and shift the plate. Get almost half of it should be good, healthy vegetables, enough protein, as was just discussed. In fact, start with the protein and have good starchy vegetables. Definitely eliminate things like vanaspati. Use good oil, especially olive oil. And again, good diets that have shown to decrease mortality include Mediterranean diet and DASH diet. Sugar is a big, bad thing. If you can avoid it, more power to you. Try to go with minimally processed whole foods and plant-based. Again, that's just to summarize that. Most of the plate எடுத்துக்கிட்டிங்கன்னா அதில் ரைஸ் இருக்கக்கூடாது, வெஜிடபிள்ஸ் இருக்கணும். And not fried vegetables. Potato கூட எனக்கு பிடிக்கும், so I'll have French fries-ங்கிறது is not really a vegetable. The other thing, ensure that you stay physically fit, right? A lot of people, and I think this is kind of changing, but many times women especially, and women also do get heart disease, by the way. Breaking news, it's the number one cause of mortality in women too, is heart disease. Weight training is extremely important. And the more muscle you have, think of it as something that can absorb your glucose. So glucose sponge mari vechkonga. At least get 2 or 3 sessions per week. Most days try and get some kind of aerobic activity. Now it doesn't mean you have to go and run on the treadmill for an hour. Just park your car a little bit further away. Lift edukadinga. Take the stairs. We can all do better, myself included. Adhe madri one hack. And I've learned a lot of hacks from Mr. Shiv Shankaran, but one of the things is, hey, right after we eat, this is a simple thing. Don't go and sit down. Walk for a little bit and then go sit. Now, in fact, Dr. Gomati just talked about sleep. Could not emphasize enough. If you don't sleep enough, you make bad decisions with your food. Sleep is our superpower. Please ensure that you get to bed early, wake up early, try and get at least 7 hours. Easier said than done. I myself, this is one of the big challenges, especially with travel and jet lag, but you should really try to prioritize sleep. The other thing, of course, talk to anybody and everybody. We all have stressful lives, right? We have to learn techniques as to how to handle stress. It's easy for me to come and say, okay, stress up, but you have to work on it, just like anything else in life, right? For your jobs, we got certain skill sets. Adhe madri stress ko, what do we do? Learn breathing exercises. There are some wonderful techniques, but put in some time and effort. It's totally worth it. Again, they've talked about a lot of the supplements, and there is a general perception in our country, like supplements la edukku enna edentana. I've now practiced predominantly in India for almost 7 years. I can say almost everyone is vitamin D deficient. B12, especially vegetarians, is very low in a lot of people. We have talked about omega-3 already enough. CoQ10. So there are at least some supplements that I would say are practically mandatory in our part of the world. But of course, it always is optimal to work with your healthcare provider and get a tailored thing for what all you need. Guys, can we go? Okay, there we go. Okay. The other thing is proactively, getting into pharmacology, right? We talked about LP small a, for example. So there are newer therapy like PCSK9 inhibitors, etc., that can really do well. And in fact, and this is a very, very rapidly evolving field. So stay posted. Some of the drugs are not approved in India yet. Some have been shown to reduce your LP small a to more than 90%, etc. So there's going to be a lot of things happening in this field, so stay posted. Now, of course, statins there's bad press, but one of the most evidence-based things for patients with heart disease, for documented heart disease, is high-intensity statin. Now, of course, these things can change. Everything that I say might be challenged in the next 5 to 10 years. It can happen. But the point is, if you know you're at risk, take ownership and manage your risk factors. The number of patients that are walking around is like, okay, I've never been to a doctor. It's like first time they present with a heart attack. And then they're like, I am so surprised that I had a heart attack. And then the next question is, do you have any problems, any medical problems? The answer is always, I shouldn't say always, 90% of the time, I'm like, the answer is no. But now I've become smarter. I ask them, when is the last time you had a checkup? It's like, I'm fine. I don't need a checkup. See, here's the thing. Nama blood pressure and nama cholesterol and if you have many times even diabetes is asymptomatic. So unless you have testing done, you won't know. Okay. So in general, at least these tests I think are mandatory. The first ones on top, LP small a at least once in a lifetime. Get a proper lipid panel done, HbA1c, and of course there are newer tests. You could do fasting insulin, HOMA-IR, and a whole lot of tests. I'm not getting into all the testing right now in the interest of time. You should know your blood pressure, HSCRP perhaps, and for those, in case you're like worried about do I have heart disease, etc., a coronary artery calcium basically tells you if there's any calcium in the coronary vessels. And nama body everything calcifies. Like eventually as we get older, we essentially petrify. So calcium is kind of the end stage of atherosclerosis. And sometimes even a CT-CAG might be indicated. Point anana, be proactive, get informed, take ownership, figure out what you need for your body, discuss with your primary doctor, and then go from there. More knowledge, you're going to make better decisions. Now, here's the other thing. Many times, we all want quick fixes, right? Now, bypass pantana, it's all cured, stent vechitana, it's all done, etc., etc. So there is a role, but I would like to just illustrate, I kind of like this analogy, right? See, I do a lot of complex work, like I said. So I consider myself as a guy with a, mechanic shop, a body shop. So I'm really good at fixing cars. So that's where you have no right coronary vessel. That's one of the 3 major vessels. Dr. Venugopal talked about LAD blockage. There is no right, and this patient is post-bypass. That's why it looks so ugly. We can open up a lot of vessels, okay? So I have a nice body shop, and bypass surgery is where they essentially bypass. So if you have a very tight blockage, instead of blood going through that, they basically it's like putting a bypass road. Stents na idukra road nama open pandrathu. So if you want to take control how you live, your stress, your diet, your sleep, your supplements, your being involved, your regular checkups, that's your healthy lifestyle. That's like driving safely. Drive panambodhu we tell people like don't text and drive, don't drink and drive. And the madri da, one life, one body is one car. And again, this earlier on I said what it meant to be metabolically unhealthy. If you fail any of this, you're metabolically unhealthy. And again, this also would change with time. So to summarize, right, redefine your lifestyle, supplement when you need to strategically, proactively screen. And again, I think you should also share knowledge because there is a lot of myths out there about health. So the more aware you are and you take, you become a community leader, the better it is for you and your family. Yes, I did say that we are at a higher risk for cardiovascular disease, but this is not set in stone. Many times, healthy lifestyle, good supplements, etc. can affect your epigenetics and actually reduce your chance of heart disease significantly. Okay? So rather than be reactive, I would say be proactive. And for heaven's sake, don't come and see specialists like me straight. See a primary doctor first and then come. In case prevention fails, right? There are always options. The first thing I do want to tell you, 2 take-home things I really want to emphasize on. In case someone has chest pain, heartburn, etc., etc., and this is more of a public health message, many times we wait. We are like, okay, doctor, I trust this one doctor. Don't get hung up on that. If you have a new symptom anywhere from your belly button to your jaw, that's not going away. Again, I'm saying a new symptom, discomfort, nagging shoulder pain, heartburn, whatever, because it can present in various ways, right? If you don't know what it is, it's a new symptom that's lasting for a couple of minutes, please take an aspirin, hydrostatin. Don't say I'm going to walk it off, etc. Get to the nearest ER or the hospital. If you can get an ambulance, great. If not, have a friend or a loved one drive you there. Because you don't want to ignore symptoms and later find out or worst case, have a major cardiac event and not make it. The other thing that I do want to tell you is, we've already talked about it. Many times, when it comes to blockages, etc., we have all talked about prevention, but sometimes, unfortunately, people still get disease. It's like saying, I'll drive safely. Can you still have an accident? Yeah, you can. So my key important thing is any blockage actually can be done in any way, right? You could bypass it, you could stent it, etc. Therapy for a patient should be based on what the patient needs and not my ability to open up a blockage or not. So get an opinion, if need be, from a second competent cardiologist. Thank you.